1 in 5 Canadians will experience mental illness or addiction, and for the first time in history, mental illness is ranked as the #1 health concern by Canadians.
We want you to know that no matter who you are or where you are not alone.
There is help, and there are people to talk to. We're here to listen. Help us raise awareness, inspire conversations, and transform mental health with Maple Leafs Hockey Talks.
Visit mapleleafs.com/hockeytalks for more information on how to get involved.
Welcome back to our Molson Canadian TML Talk Game Day Skate. It is Hockey Talks tonight at the Air Canada Centre as the Leafs will be entertaining the New York Rangers. This is a mental health awareness initiative that is partnered up with the Toronto Maple Leafs, and this is Dr. Katy Kamkar. There we go. I said it right. So talk about this initiative. I mean, you have come on to talk about this in the past. So just reiterate for some of our fans that aren't aware.
It's a wonderful, fantastic initiative. The main reason being 20% of Canadians suffer from mental illness and or addiction within a year period. So 1 in 5 Canadian is affected by mental illness. So we need to raise awareness. And especially also comes when it comes to hockey. We know that within the sport, there are a variety of stressors, including anxiety, that athletes do experience. So having events such as Hockey Talks becomes very, very important.
So what are some of the triggers or signs that you can notice that someone is experiencing a mental illness or addiction?
Well, there are a variety of, stressors, for example, that we know that athletes go through. In addition to daily struggles and hassles and significant life events, we know that they have a lot of stressors associated, for example, with competitive performance. That would include sport-related injuries and pain, stressors in regards to preparation, physical preparation, mental preparation. We also talk about underperforming, so when they're not able to achieve their goals, and also expectations they might have about themselves or from others. So there are a variety of stressors. And of course, if we experience anxiety and worries more days than not, or we feel other negative emotions, including anger or sadness, along with difficulty sleeping, concentrating, appetite changes. We might also have maybe suicidal thoughts or physical symptoms associated with stress. That could be abdominal distress and headaches and muscle tension. If we experience those symptoms increasingly over time and or they interfere with our ability to engage in our daily responsibilities and at work, then it becomes very important to seek help.
Now, it's great that there's been a large influx of the talk surrounding mental health and helping break that stigma that surrounds it.
Yes.
The Toronto Maple Leafs are a proud representative of the Hockey Talks program, which is helping break that stigma. But there's also a lot of talk around resilience.
Absolutely.
So could you touch on what resilience essentially defines in this context?
This is so important because most of us, if not all of us, experience a range of difficult and upsetting life events. And so resilience is really being able to bounce back from those upsetting events. And it's not a one-time event. It's an ongoing process. And while we go throughout this process, we experience, obviously, emotional pain and suffering, but we engage in a variety of strategies and skills to be able to cope with the difficult stressors. And psychological resilience is especially important in sport because athletes need to use and optimize a range of emotional and psychological and mental qualities to be able to cope with the stressors that actually we just talked about.
Exactly. It's amazing how parallel it can be. And then what can people do, I guess, to increase that resilience?
Well, when we talk about individual and especially team resilience, right, especially when we talk about hockey, it's important to know that every single person contributes and is valuable to the team, and every single person, again, contributes to the success of the team. So healthy, positive relationship is very important. To have this quality social support network is important. It also helps not to perceive crisis or problems as being unbearable. So putting the upsetting events within a perspective so that we are better able to evaluate the event and essentially move forward. Setting up realistic goals and setting up graduated steps to be able to move towards those goals becomes as well very helpful. And as well, taking a long-term perspective. So when there are difficult events, if we're able to look at them within a broader perspective, we are better able to evaluate them and in turn make healthier decisions. We also know optimism, confidence, hope are so important. Not only it's important for our daily life and to cope with the daily stressors, but it has been found that when we are very hopeful and optimistic, and also we are confident, we are better able to envision different strategies and routes, and once again to be able to move forward.
And it's amazing how easily these can be overlooked because people can roll their eyes and hear, oh, hope,
Yes.
but it really is.
It is
critical. Well, Dr. Katy Kamkar, thank you so much.
Thank
for
you
coming
very
on the air
much.
from the Center for Addiction and Mental Health. Now, fans, there's a lot going on in the game tonight, including the players will have decals supporting the Hockey Talks program. They'll also be wearing shirts and post-game interviews. If you're coming into the building, 50% or proceeds from the 50-50 draw will be going towards the Center for Addiction and Mental Health. For more information on Hockey Talks, visit Toronto MapleLeafs.ca/Hockey Talks. And for more about CAMH, visit CAMH.ca.
All right.